What is schizotypal disorder? Everyone has quirks, and that's what makes life interesting, right? You might know someone who has an odd sense of fashion or likes to talk with different accents. Maybe you even consider yourself a little different than the average Joe or Jane. Schizotypal disorder goes beyond eccentricities, though. This personality disorder is characterized by odd behavior, distorted thinking, and a preference for solitude. And most importantly, it can create significant obstacles in life. Hi, I'm Roy-Greene, PhD, LMHC, a therapist here at BetterHelp. Today, we're talking about schizotypal disorder, one of several different personality disorders recognized by the American Psychiatric Association. In this video, we'll go through common symptoms of schizotypal disorder, discuss how it's different from schizophrenia, and take a look at some of the treatment options available. We'll also talk about how to get a diagnosis and why a diagnosis is important to prevent further complications. Symptoms of schizotypal disorder. So, what does schizotypal disorder look like? There are many different symptoms of schizotypal personality disorder. A person doesn't have to demonstrate all of them to qualify for a diagnosis, however. Let's point out some of the common symptoms to give you a better picture of this mental illness. Suspicious or paranoid thoughts and fears. Someone with schizotypal personality disorder may have an inherent distrust of others and often question the loyalty of close friends or family members. Odd speech. The person may speak in vague generalizations or ramble incoherently. Strange beliefs. An individual with SPD might believe people can read their thoughts or have other special powers. Social anxiety. This is different from your typical social anxiety. With schizotypal disorder, social anxiety is persistent and tends to be focused on mistrusting other people. Illusions. SPD can cause a person to sense things that aren't there or have unusual perceptions. Flat emotions. Someone with SPD might not show emotions the same way as other people. Their expressions might be atypical or even inappropriate. Isolation. Schizotypal personality disorder may cause a person to be alienated from others. They may not desire to socialize with anyone outside their immediate family. Unusual attire. People with SPD might appear disheveled or wear mismatched clothing. Do you recognize any of these symptoms in yourself or your loved ones? Have you noticed any other patterns of behavior in someone diagnosed with schizotypal disorder? Share your experiences in the comments section, and don't forget to subscribe and enable notifications to get the latest content related to mental illnesses like SPD. Now, let's take a minute to talk about diagnosis. Diagnosing schizotypal personality disorder. Getting an official diagnosis for SPD can be important. It can also be challenging. People with schizotypal personality disorder may need a little nudging from family members to see a therapist. They don't usually take the initiative on their own. So, if you have a loved one you suspect has SPD, it may be important to have that conversation. A diagnosis from a licensed mental health professional is often the first step to receiving treatment. Your mental health care provider will use criteria from the Diagnostic and Statistical Manual of Mental Disorders to evaluate SPD symptoms and make a diagnosis. To issue a formal diagnosis, the clinician needs to see at least 5 symptoms listed in the manual. They may also need to rule out other personality disorders and related mental illnesses like schizophrenia. Don't put off diagnosis. If SPD isn't treated, it can cause a host of other problems. In the next segment, we'll talk about some of those possible complications. Complications of SPD. Left untreated, schizotypal disorder can increase the risk of other problems such as substance misuse, anxiety, depression, schizophrenia, other personality disorders, suicidal thoughts or attempts, psychotic episodes, and more. Early diagnosis and treatment can prevent these, so don't delay. Next up, we'll compare SPD to a well-known mental illness known as schizophrenia. These disorders are commonly confused, so take note. Schizotypal personality disorder versus schizophrenia. Perhaps because they're spelled alike, there's a common misconception that schizotypal disorder is the same thing as schizophrenia. But schizotypal personality disorder and schizophrenia are two distinct disorders. Let's talk about the differences as well as how the two are connected. Schizophrenia typically involves more intense symptoms and greater functional impairment. This is mostly due to symptoms of psychosis, which aren't usually present with schizotypal disorder, with the exception of temporary episodes. People with schizophrenia may experience persistent hallucinations, delusions, or both. People with SPD may be more aware of their condition. They might know that they tend to be more suspicious or eccentric than others. Those with schizophrenia might believe their delusions. Schizotypal disorder is classified under personality disorders and sometimes leads to schizophrenia. Not everyone with SPD develops schizophrenia, though. Unlike SPD, schizophrenia is classified as a psychotic disorder. Some of the same treatments may be used for both schizotypal personality disorder and schizophrenia. Speaking of treatments, let's go through some of the options for individuals diagnosed with schizotypal personality disorder. Treatment options for SPD. Personality disorders are notoriously hard to treat, and schizotypal disorder is no exception. Though challenging, treatment is available. The typical approach to SPD is a combination of medication and therapy. Medications for schizotypal disorder. Medications might be necessary to manage symptoms of SPD. So which medications are used? A psychiatrist might prescribe various medications to treat schizotypal personality disorder. These prescriptions might depend on the symptoms that are the most prominent or challenging for the individual. Some common medications include antipsychotic medications. Antipsychotic medications may be used to treat delusions, including paranoid delusions. Anti-anxiety medications. These may help with social anxiety and any other generalized anxiety symptoms. Mood stabilizers. Mood stabilizers may be prescribed to help with behavioral challenges. And finally, antidepressant medications. Some people with SPD may also experience depressive symptoms that might require antidepressant treatment. Therapy for schizotypal personality disorder. Medication might be a first-line treatment for SPD. This is because without it, therapy may trigger symptoms of social anxiety, a key symptom of this disorder. Alongside medication, therapy for schizotypal disorder usually includes cognitive behavioral therapy, or CBT, and group therapy. Due to the nature of SPD, therapy might be challenging for someone with this disorder. It could be important to find a therapist they can connect with. This could take some trial and error to find a good fit. Another option for people with schizotypal disorder is online therapy. Due to symptoms of social anxiety, in-person therapy could be uncomfortable or overwhelming for someone with SPD. They might feel more at ease in an online environment. Studies show that this type of therapy can be beneficial for treating the symptoms of personality disorders. Hopefully this video has taught you a bit more about schizotypal disorder and how to identify it. Next, click here to watch another video and learn about a related personality disorder known as schizoid personality disorder. Remember, personality disorders like schizotypal disorder can have disruptive symptoms and might be challenging to treat. People with SPD can manage symptoms and live fulfilling lives, though. For more information about personality disorders and other types of mental illness, click the like button and subscribe buttons below. Thanks for tuning in. As always, take care of yourself, and I'll see you next time.